But yes, that's
Well, I admit I've been reading about you for a long time. I've never met you until last night. I guess just to kind of, in case people don't know, and how can you not know, but in case people don't know about you, or I'm curious a little bit about your kind of electronic or e-medicine background that you've been referring to because of coming here to HIMSS. I'm not that familiar with that.
well, I a few years ago I got a sudden diagnosis that I was almost dead with kidney cancer. And when you read that your median survival time is 24 weeks, that tends to focus the mind. And you get this after the shock. You get this question: okay, what can I do to help myself? And even though my odds were very slight, I mean, the websites that I read said outlook is bleak, prognosis is grim. So like I really am picturing the idea that the book of what happened in Dave's life was coming to a close. Like that's it, no more chapters. And so I did everything I could. It was sort of like that old cartoon of a frog being swallowed by a bird, and even as his head goes down the bird's throat, he's reaching out and choking. So I Googled my butt off. I said, even if there's no hope medically, I'm going to use everything I can in the way of mind power. Even if there's no evidence for it, what do I have to lose? And as it happens, I got great care. The treatment that usually doesn't work did. And within 6 months, I was pretty much all better, which is astounding. Then I discovered that my doctor belongs to this e-patient study group. He's one of the pioneers of doctor-patient email, Danny Sands, well-known figure. And he invited me to come meet the e-patient group, and I read their white paper, and it just blew my mind, because what that paper catalogs is all the different things that I had done using the internet and being an empowered, engaged patient. So I'd already decided that I had a free replay in life because I was gonna die and I didn't. And I mean, I know statistically that's not a pure statement, but I mean, that's what my experience was like. And so I started a blog called The New Life of Patient Dave. Then when I discovered the e-patient movement, I just renamed myself e-patient. E-patients are, say it with me, people, equipped, engaged, empowered, and enabled. And now we increasingly talk about being educated about evidence so that we're not just happy dorks. We're actually interested in the science.
Wow, so
Excellent. There's another E.
There's another. Well, thank you.
questions, comments?
So you found your diagnosis and then you Googled your butt off. Like, what sites did you turn to? What resources did you use?
So that's a terrific question. I'm trained as a scientist, right? I understand evidence. I have no interest in flaky stuff. A couple of years ago, somebody who heard that I had cancer latched onto me without any provocation at all and said, chemo doesn't work, and all you need is properly ionized water. And now, for one thing, she hadn't bothered to find out that the kind of cancer I had, you don't use chemo. But that wasn't going to stop her from having her point of view. I just Googled, right? At first, my first symptom was, a spot showed up in a shoulder x-ray that was a spot in my lung. We didn't know yet that it was kidney cancer. So I thought, I was Googling lung cancer and learning what I could about that. Once we knew it was kidney cancer, I Googled that. And what I read on WebMD and all of the other good FDA-approved and what I call encyclopedia-style websites is the reliable generic information. And that's where I read, outlook is bleak, prognosis is grim, which is true because statistically the odds are really bad. But what I didn't find until I went to a patient community, a smart patient community, was a reminder that statistics apply to populations and individuals have their own individual case. I now express this in a biological way. This is the polite version of it, is to say that the average person has one ovary, which statistically is correct, but gives you no useful information about any individual, right? And you can imagine the variations that one might have after hours at HIMSS on that
That'll hit me on the plane home today, and I'll be like, "Wow, man, that's yeah."
Well, seriously, I understand completely that a reference website has to publish generic verifiable information. What patients need is answers to the question, okay, what can I do? What are my options, even if they're low probability or whatever. And in fact, what I found on ACOR, the acor.org, within minutes of my first posting there, I lurked for a couple of days, and within minutes of my first posting, what I got back was, okay, if you have stage 4 kidney cancer, you need to get to a specialist center because it's not a common disease. You want to try to get high dosage interleukin. It usually doesn't work, but it's the only thing that comes close to producing a cure. And if you get something else first, you may not qualify for interleukin later. And the names and phone numbers of certain oncologists who specialize in that treatment, which is fabulous, you know. And I want to say also that this whole e-patient movement, in my view, the part of it that I represent through the Society for Participatory Medicine is not at all about overthrowing physicians. To the contrary, it's seriously. It's about becoming an effective partner. You know, a large part of the information that's in the e-patient white paper is about the extraordinary overload that physicians face. You know, the huge, and Val and I have discussed this before, the huge number of new journal articles that are published every day, every week, every year. Not everybody has to read every one, but on the other hand, the Patient-Centered Primary Care Collaborative told me last year that the average physician these days, to make ends meet with the economic pressures, needs a panel of 1,500 to 2,000 patients. So in rough terms, that means for every 1 in 1,000 disease, you've got 1 or 2 of them, right? And trying to keep up with everything. And in contrast to that, I had a very particular focus. And I was happy to go deep. And the thousands of people in my ACOR kidney cancer group from around the world, you know, sharing information about clinical trials and latest outcomes. They actually identified a previously unknown side effect for Sutent that hadn't shown up during the trials. I mean, the post-market occurrence of side effects is natural because within a trial, you have to have clear, essentially uncomplicated cases, right? So, and then when you get out into the real world, people are complicated. So anyway, it's about becoming a more effective partner with your physician. And, you know, it's funny because in the last few months, as I've spoken at different events, I've started to realize that there's a sort of an inauthentic sense that the patient community has sometimes, that doctors ought to be responsible for knowing everything, doing everything perfectly, and so on. You know, when I decided to use mind approaches to help my case way back in the beginning, one of the first things I thought of was Norman Cousins, the Saturday Review editor who laughed himself back to health. At the time, we didn't know it. Today we know about psychoneuroimmunology, that mood can actually help the immune system. But at the beginning of his book, he says, it's my opinion that every patient must bear some responsibility for the outcome of their disease.
Wow, I'd love to talk more about this, but we're gonna have to wrap up. And yeah,
we're working at it seriously.
That's a great story. So for people who want to find you on the internet, where can they find you and follow you and read more about what you're doing?
Well, our blog is epatients.net. That's e-patients.net. The society is participatorymedicine.org. Its journal, the Journal of Participatory Medicine, is jopm.org. And my personal website is EpatientDave.com.
Sounds good. Well, this is what's great about HIMSS and just doing this live, and just ePatient Dave just showed up, and thanks for playing along with us and talk with us.